Good morning, and welcome back to the Haven Financial Group radio show. I'm Larry Kalvig, founder and CEO of the Haven Financial Group. Please give us a call, 612-504-8400 or havenfinancialgroup.com. All kinds of retirement tools on there, a community website, really great website. Kim, it's good to have Isabella Kehoe on, our insurance specialist here at Haven Financial Group, because this segment we're talking about the things we don't like to talk about: healthcare, Medicare, long-term care. And I will tell you, observation over all these years is many folks planning for retirement, they don't plan accordingly for the costs associated with this topic. And it's important to factor into your retirement planning.
Absolutely. Isabella, great to see you, and thanks so much for being a part of the show today. Let's talk a little bit about just what Larry said, the budgeting for healthcare. We'll just start with healthcare, before we even get into long-term care, but just healthcare. It's got to be one of the bigger expenses in retirement, and really one of the most important.
Yeah, absolutely. Well, thank you for having me on first off. But yes, I think a lot of our clients and a lot of people at that retirement stage can be taken aback by the costs that are associated with a lot of this planning, whether it's just your medical expenses, whether it's your Medicare premiums, even that aspect of that long-term care planning can kind of creep up on people. It's something that people don't like to discuss, right? No one wants to plan for all of those things. It's not the most fun topic to have a conversation on, but it's really important to plan ahead so you're not taken by surprise when you see those numbers. Absolutely.
I think a lot of people believe that Medicare means I don't have to pay anything, that the government's going to take care of me. And I'd like to know when that's happened before, much less in retirement and certainly healthcare. So let's walk just through. I realize it's very complex, but let's walk through, when you're talking to someone about their planning for their healthcare, sort of those Medicare numbers and what they need to be aware of.
Yeah, absolutely. Typically, we recommend people come in about 3 to 2 months before that 65th birthday, or when you're, past 65 and you're losing your employer coverage. That's a good time to come in as well. Medicare is made up of different parts. It's kind of the alphabet soup of Medicare, right? We have our Part A, Part B, Part C, and Part D. Part A of Medicare, we prepay for with our Medicare taxes when we're working. So there's no cost associated with Medicare Part A, that inpatient hospital care, when we're collecting those benefits. It's something we've already paid for. Now, Part B is a different story. We have some premiums that are associated with that program. That premium this year for 2025 starts at $185. But that can be adjusted. If you're falling above certain income levels, that is something that can be increased for you. So it's important that we're paying attention to the whole financial plan when we're looking at our Medicare.
And just so everyone knows, Part B is preventative care and doctor's visits, right?
That's correct. Yeah. Any outpatient services we're receiving are going to be covered by Part B.
Okay.
And one unexpected area, too, is your durable medical equipment. Not a lot of people realize something like an insulin pump for your diabetes. That's going to be covered by Part B.
Okay. Then there's C.
Yeah, Part C is another name for our Advantage plans, and that's going to fill in all of the gaps that Medicare by itself, that Part A and Part B of Medicare isn't covering for us. Some people don't know that Part A and B of Medicare, there is no maximum out-of-pocket for that program. So those bills that we can have for just our hospital visits or our doctors, there's no cutoff point for those bills. So it's important that we get either that Part C plan or a Medigap plan.
All right. And then finally D, and that's prescription drugs, right?
Correct. Yes, you're right. And Part D, I think it's important people know that the penalties that can be associated with delaying your Part B, those incur a lot quicker than other aspects of Medicare. So it's important that we're making sure we have credible drug coverage at every stage during our Medicare journey so that we avoid those penalties.
Okay. So
they start incurring after 1 month of no coverage.
Okay. So Part D, you do have to, that's a separate bill. That's a separate, fee for you.
Yeah, typically it's a separate plan for people enrolled in a supplement plan. Some Medicare Advantage plans will include that Part D benefit. So not everybody has a separate Part D plan. Some people have that included in their Part C Advantage plan.
Okay. You were talking about some dates and when this needs to be taken care of, but can you walk through those dates exactly when you need to get your Medicare situation under control?
Yeah, absolutely. So Part D of Medicare, that prescription drug coverage, it's really important that we have that in place, because if you delay your Part D and you don't have any kind of health care plan in place that's covering your medications, you'll get a 1% of the national average penalty on your premiums. And that's a lifetime penalty. There's no way around it. So even though it's not a significant number, right, it's important that we plan around that.
Sure.
Part B of Medicare, it's important we enroll in a timely manner, but there's some more flexibility. It's 12-month period during which those penalties will start to incur. So a little bit different there, but really making sure you have that credible coverage is the most important piece of this Medicare planning.
And Part C, are you locked in for the rest of your life, or do you have opportunities to re-enroll in different plans?
Yeah, what's really nice about those Part C plans is you have some flexibility. So every year during annual enrollment period, which is October 15th through December 7th, you can change your Medicare Advantage plan. And there's also another window that not many people know about, January 1st through March 31st, during which you can make another change. So it really allows us to find some savings, find plans that we're happy with, and really make adjustments throughout the year.
Kim, if I may add too,
Yes.
if listeners are paying attention, human nature is complacency. And while I'm on this plan, and I've always been on this plan, if you've not looked at your plan, you really should look at your plan every single year, not because it's so fun and exciting to look at your plan. And by the way, you don't pay any more to have an independent with a non-biased approach like Isabella here and Glenn in our office. So we help many people in Medicare save money every year, because just when you figure Medicare or healthcare out, then they change the rules, and then they're going to change the rules again. So please shop it out every year. I mean, I've read recently studies that people pay $700 to $1,000 annually every year, too much, for the wrong care because they don't take the initiative to shop it out. So I can't encourage you more. You don't pay any more by having somebody work for you, or you shouldn't, at least. And by the way, also, do not listen to every paid spokesperson on television.
That was going to be my next.
That
Right.
probably is not a good idea.
Right. First off, it varies from state to state, correct?
It does. It does,
Yeah.
right? But
Yeah, state to state is different. For your Medicare Advantage plans, even by zip code to zip code, it can be different. So we really encourage people, while that water cooler mentality is easy to fall into, right? And going based off of decisions that your friends made or your cousins or your neighbors. Well, it's great to have those conversations, take everything with a grain of salt, because they're not even in the same zip code. Maybe that's not even an option that's available to you.
Absolutely. Let's talk about long-term care. This is the one that really is scary. We've talked about the statistics here on the radio show before. I mean, a lot of us are going to need long-term care. Larry, what was the percentage? I've forgotten.
70% of us are going to need some sort of health care or some sort of nursing home or some sort of coverage. Yet nobody wants to talk about it. And I understand why we don't want to talk about it. Who would want to talk about? But if you're dealing with a loved one, a mom or dad or a parent or whomever it is, you know exactly what I'm talking about right now. And no time is better, again, than now to have this discussion. I just had a gentleman in this past week from Northfield. They're moving to Faribault, and him and his wife. And unfortunately, almost everybody in his family has gone into a nursing home of some sort. The Alzheimer's, dementia, and those types of things run in the family, unfortunately. I hope none of us have to, but the numbers it's amazing. And at $10,000 to $15,000 a month for nursing home care, that'll decimate an estate really quickly. I don't care how wealthy you are.
Yeah.
There's a lot of good options out there that have not been available for a long period of time. I encourage you to come on in and have the conversation. There's no cost for a conversation to see if it's applicable to you and if there's better options, because people were scared to death of a Cadillac plan that somebody tried to sell them 10 years ago that nobody in their right mind could afford. But there's better options out there for sure.
Yeah, Isabella, that's the thing. People get really frightened when they hear long-term care insurance because it was so astronomically expensive.
Yeah. And I think what's important, right, is to note that those premiums are only going to go up with age. So the longer that we sit on that decision, the more expensive it's going to get. So starting that initial conversation is really just the best thing to do, right? Start taking action there. Like Larry said, let's not fall into that complacency that humans are so prone to.
Isabella, if I buy long-term care insurance and I never need it, Are there policies out there that money could ultimately, land in the hands of my loved ones?
Yeah, there's a lot of different options about how you can structure, the legacy planning as it's related to long-term care insurance. And there's a lot of different vehicles that we can use to accomplish that. There's long-term care annuities, there's those traditional policies, right? So when we have that initial conversation, that's something that we can explore is, hey, what do we want as a priority for if we don't touch this money? What are we worried about if we do? Kind of having that conversation and aligning those values so we can find a product that's going to be best suited for you.
Isabella, our time has gone so quickly with you. What would you like people to take away from this segment?
I think the most important thing is just to start taking action, whether it's scheduling that Medicare review to make sure that you're not paying more than you need to, whether it's having that long-term care conversation that, a lot of us like to avoid. The first step is really just coming in, having that conversation, and let's take a look at your situation.
Absolutely. 612-504-8400. That's how you make an appointment and get in there to see Isabella and some of her cohorts there at Haven Financial Group. Again, it's 612-504-8400. You can go to havenfinancialgroup.com for more information. Isabella Kehoe, thank you so much for being part of the show.
Thank you for having me on.
Absolutely. Larry, when we come back, let's talk about some of the unique situations that our Gen Xers are facing as retirement looms. This is the Haven Financial Group Radio Show.